Hello there, Pattaya. It's Dr. Ian, and I am at the Bangkok Hospital, Pattaya, and this is another one of our Healthwise series. Today we're going to talk about pediatric cardiac problems. In other words, heart problems with children, and in particular, very small children. With me is Dr. Shutikarn, who is a pediatric cardiologist. Welcome to the program. Thank you. Right. You are a pediatric cardiologist, so you deal with children from what age to what age?
When after birth
Right.
to adolescent. Some children with congenital heart disease, we will take care of them until lifelong, because some congenital heart disease is quite big different from adult cardiology problem.
Okay. I've heard of the phrase blue babies.
Yeah.
Would you like to sort of go on a bit further? What are blue babies?
The blue babies is the baby was born with deoxygenated situation. In generally, we have heart and lung. The lung is the rich oxygenated tissue, and the lung can give the oxygen into blood circulation.
Right.
If some problem with heart or lung, the children can coming in the state we call that blue or cyanosis. The
Right.
cyanosis baby majority is the lung disease, but the most serious condition is cyanotic heart disease.
Right. So you would pick this up at birth?
Yes, sure.
So in what way do you actually make this diagnosis? Is it done through echocardiograms, or what do you do with these little bubs which are only this big?
The first important thing is physical examination. I can do everything and pick up the information from echocardiogram, chest x-ray or EKG to make the diagnosis.
Right. With modern technology, of course, it is so much easier, if you like, to actually sort of see what is the problem area. In the bad old days, it wasn't quite as easy when we didn't have echocardiograms and things like this. What percentage of newborn have one of the cardiac problems, congenital cardiac problems?
Yeah, it's about 8 per 1,000 live birth.
Okay, so 8 per 1,000. And what about major problems?
The major problem is VSD, ventricular septal defect. It is a cyanotic heart disease, but the most common problem of cyanotic heart disease is tetralogy of Fallot. Is about 0.5%,
Right.
50% for all cases.
Okay, that's a condition called the tetralogy of Fallot, which I remember from my medical student days. Let's imagine now that you have found a child with a ventricular septal defect, hole in the heart, as it's known as. Can we do it here, or do you refer the baby to one of the surgeons in Bangkok, for example?
Firstly, I have to consider about the size of baby and the size of the hole, and the symptoms of the baby. If the big hole, maybe the surgery in neonatal period or infancy period, I will send to the hospital in Bangkok, in BMC hospital, the
Right.
Bangkok hospital in Bangkok. But if the small hole, small size,
Right.
and we call hemodynamic insignificant, maybe
Okay.
we can follow up of a moderate size or something in between big and small. Some medications, and when they grow up, I will consider again about the moderate size, surgery or spontaneous closure, or to being small.
Okay, Dr. Shutikarn, thank you very much. And if you are out there and you are pregnant and you are worried about your forthcoming little baby, I think it should be comforting for you to know that we have people such as Dr. Shutikarn who can diagnose problems before they become major problems. Dr. Shutikarn, thank you again. And Pattaya, I'll see you with our next HealthWise program.